Hello and welcome to today's presentation. Today we are looking at nephrotic syndrome. This is a kidney disorder that is characterized by three major symptoms: proteinuria, edema, and hyperlipidemia. Okay, so how does proteinuria result, and what about the sign and symptoms? We are saying that the hallmark sign of nephrotic syndrome is proteinuria, and this one refers to the presence of excessive protein, primarily the albumin, protein albumin, in the urine. So, guys, in normal circumstances, we expect the kidney to filter waste products and excess substances out of the blood while retaining essential proteins. However, in nephrotic syndrome, you find that the damaged glomeruli will allow large amount of proteins to leak into the urine, and this leads to protein in urine, thus the name proteinuria. So the loss of protein in urine can result in a decrease in the amount of protein level in blood, and this one leads to another signs and symptom that we normally refer to as hypoalbuminemia. So proteinuria leads to hypoalbuminemia. Let's look at the second sign and symptom. We have edema that of course is generally referred to as swelling. So how does edema occur? We're saying that we can start by defining what edema is. This is the accumulation of fluid in the body tissues, and when this happens it results into swelling, in which there is another prominent sign and symptom of nephrotic syndrome. So apart from proteinuria, another prominent sign and symptom of nephrotic syndrome is edema, guys. So the low levels of protein in blood will lead to decrease in the oncotic pressure. Okay, so low protein in blood leads to low or decreased oncotic pressure. And what is the work of oncotic pressure, guys? The work of the oncotic pressure is that it is supposed to keep the fluid in the blood vessels. So when this pressure decreases, automatically the fluid will leak outside the blood vessel into surrounding tissues, and when this happens it leads to edema. So it's also good important to know that edema can present in various parts, including the legs, ankles, hands, and face. So apart from proteinuria, hypoalbuminemia, which is counted as just as proteinuria, guys, edema, we also have hyperlipidemia. So we have more lipids. Why do we have more lipids in a person suffering from nephrotic syndrome? We're saying that this disease normally leads to alteration in lipid metabolism, resulting in increased levels of cholesterol and triglycerides in blood. So guys, remember we have talked about the loss of protein in urine. So this one, normally we have compensation in the body. So whereby the loss of protein in urine triggers the liver to produce more lipoproteins, which transport lipids to blood. So this is in case to compensate for the protein loss. So this in turn leads to elevated cholesterol and triglycerides. So hyperlipidemia in nephrotic syndrome is a significant factor in the development of atherosclerosis and cardiovascular complications. So guys, explain why someone suffering from nephrotic syndrome is at risk of developing atherosclerosis. Guys, it's because of the decreased proteins normally leads to compensation in the body. By now the liver will be triggered to produce more lipoproteins, okay, and these lipoproteins normally transport lipids in the blood, okay. So as a result, someone has more cholesterol and triglyceride, which places them at a greater risk of getting cardiovascular complications like atherosclerosis. So guys, those are the three main signs and symptoms of nephrotic syndrome. So what are the interventions? In the case of the intervention, you are supposed to monitor vital signs, the intake and output, daily weights, Remember, regular monitoring of vital signs such as blood pressure, heart rate, respiratory rate helps assess the overall condition of the patient. Monitoring the input and output provides information about fluid balance, and daily weights can indicate changes in fluid retention. Okay, monitoring urine for specific gravity and protein. So monitoring of this helps in assessing the concentration of urine, which can reflect kidney function. Also, monitoring for proteinuria, that is presence of protein in urine, is crucial hallmark of the nephrotic syndrome, as we have indicated. We also have another intervention where we monitor for edema. Okay, so this is also another common symptom of nephrotic syndrome due to fluid retention still. So monitoring for edema, particularly in areas where like the legs, like the eyes, can help gauge the disease progression and response to treatment. We also have nutrition. We also have corticosteroid. Why are corticosteroid prescribed here, guys? So corticosteroids are often prescribed to reduce inflammation and control immune response. So in cases where the corticosteroids are not sufficient, immunosuppressants can also be administered. What about diuretics? Diuretics help increase urine output, which can reduce edema by eliminating excessive fluid. So they are often used to manage fluid retention and swelling. We also have plasma expanders. Remember I said we have proteinuria, loss of proteins, especially albumin. Okay, so for severely edematous children, plasma expanders like salt poor human albumin may be prescribed to help reduce the sinus symptoms by increasing blood volume and improving circulation. So the last intervention is about education. Okay, so guys, those are the three signs and symptoms of nephrotic syndrome. Number one, proteinuria, which normally leads to albuminemia, hypoalbuminemia. Okay, next we have edema that results from decreased oncotic pressure, okay, as a result of loss of proteins. And loss of proteins again will lead to compensation by the liver being triggered to produce more lipoproteins, resulting in hypercholesteremia, predisposing the patient again to cardiovascular disorder. So those are the three major signs and symptoms of nephrotic syndrome.